Started. Okay, great. Hi, everyone. Welcome to Niyamat's podcast. For this episode, we will be speaking to Minaish Dhabhar about OCD. So, thank you so much for being here, Minaish. Do you want to tell us a little bit more about yourself and how you've been handling the entire quarantine scenario?
Thank you. Thank you for having me here, Ananya.
Mhm.
I am a therapist. I graduated with my master's in clinical psychology last year during the whole quarantine scenario, and
Mhm.
I started working a few months after that.
Mhm.
Um, I I will say that for me personally, and this is possibly because I hadn't conducted therapy uh, in a one-to-one setting before. So I will say for me, online therapy has actually been great. I've been quite
Mhm.
surprised with how effective it really can be, because there are a lot of people who say, and this was my belief previously as well, that
Mhm.
this is something that just doesn't work or it's not wonderful. But my experience with administering therapy even from remote settings has actually been quite pleasant. So
That's wonderful to
yeah,
hear.
yeah.
That,
Um, how about your mental health during the whole lockdown and pandemic and things like that? Did you notice that it changed a little bit?
Oh, definitely. Yeah, I don't think it's easy for us to as human beings. I don't think it's an inherent human nature to actually be accepting towards change in any way. And I feel like a lot of our lives just completely overturned, right? Everyone had plans to start a job or to start their higher education, and all of those things have sort of been put on hold, or they're performing at limited capacity. And yeah, things didn't turn out the way that we wanted them to be, so that's
Yeah,
always going to be challenging. But it's really cool that we've resorted to things like online therapy, and we're finding workarounds to these lockdown specific situations, that it's so that's what I admire, the spirit that we have to just keep going, even, and just to try to make the best of the situation. So
absolutely.
yeah. So regarding my mental health, when it first started out in March last year, it was pretty overwhelming, and I was pretty confused because I had plans to continue working in Bangalore, and I was really enjoying my life there. So all of a sudden, having to come home and the entire family is back together, which is something that my parents love, and like it's nice to have, all this family time, which otherwise we weren't expecting. So that was something that I think has been a boon to just get some more time to spend with my family. But yeah, besides that, a lot of other plans have been put on hold. So that's just a slightly disappointing bit. But yeah, I think a lot of people are just going through the same thing. So that just sort of makes it a little easier. So,
It really does, this sense of collective. I was talking to a friend the other day and I said,
mhm.
it brings us so much comfort, at least it brings me so much comfort to know that the same pandemic I'm experiencing is the same pandemic that Michelle Obama is experiencing, is the
Yeah.
same pandemic that Beyonce is experiencing. And it's really cool that
Mhm.
the world has sort of, I mean, under unfortunate circumstances, I know, but that the world is finally fighting against something together as one unit. And
Yeah.
that is kind of a comforting thought for me.
Oh, for sure. That I find that so empowering, that to think that, yeah, the same pandemic that you're experiencing is the same that Michelle Obama and Beyonce are
Mhm.
experiencing. And if they can get through it, then you can definitely get through it. That's a
Yeah.
beautiful spirit to have. Yeah. So thanks so much for that perspective, Minaj. And yeah, jumping into the subject for this session, we'll be talking about OCD. Now, a lot of us have seen depictions of OCD on through the media, and a lot of us actually have a very limited capacity of really understanding what it really means. So let's start there. What is OCD? What does it mean? And
Right. Well, I am so glad we are talking about this today because, like you said, in the past 1 year, we have all experienced a lot of change and
Mhm.
uncertainty, and certain mental states that come out of this sense of uncertainty, or our ability or our difficulties when dealing with that, include anxiety, OCD, things like that. So I do think that the pandemic has led to a rise in these conditions, and I think this is a great time to be debunking some of these myths because there are so many when it comes to OCD, right? So, very simply put, OCD, which stands for Obsessive Compulsive Disorder, is a mental illness which is characterized by these very rigid, repetitive, and often distressing thoughts, right? And these are called obsessions. And we'll get into them in a little more detail in a bit. But these repetitive, rigid thoughts often drive us to engage in certain repetitive, often ritualistic behaviors. And these are called compulsions, right? And these often cause major disruptions in our day to day routines, our general patterns of living. We are known to avoid certain triggers. A lot of people with OCD will end up deciding not to leave their house because it can really be so distressing, right? So, getting into obsessions, which are the thoughts that we spoke about, they are involuntary and they're not always thoughts, they're often images, right, which can be quite distressing. Sometimes they're urges, sometimes they're impulses, and they occur over and over again in our minds, right? And these are ideas that many of us don't want to have, but they are very, very difficult to control or to stop, right? So, this is why they become quite distracting and disturbing. So there are different types of obsessions. I know one that everyone keeps talking about with respect to OCD is the fear of contamination, right, or dirt. But there are so many more. There is the fear that harm might come to yourself or a loved one, an excessive need to do things perfectly or in a perfect order, things like that. So again and again, the person will keep having these thoughts and they'll keep coming back. Thoughts like, oh no, I left the house and I must have forgotten to turn off the gas, right? And these are thoughts that many of us commonly have. But in the case of OCD, the reason we call them obsessions is because these thoughts are very strong, very rigid, and will repeat themselves again and again, no matter how many times the person has checked the gas. And this checking of the gas, this behavior brings us to compulsions, right? So, compulsions are basically these ritualistic behaviors that we often feel driven to act out, very often in response to the obsessive thought that we have had, right? Very often they're not necessarily enjoyable behaviors. In fact, most of the time they're not, but they do provide some amount of temporary relief from the anxiety that the obsessions bring us, right? For example, if I have this thought that I have forgotten to check the gas, if I tell myself, okay, I will go back home and check the gas once, twice, thrice, maybe the fourth time, me checking the gas reduces some of that anxiety. It takes away that thought for the moment, right? Now, the fact that there is a temporary relief from anxiety sort of reinforces this compulsive behavior, which means when the obsession comes back, and it does, this cycle of obsession, compulsion strengthens. Right? Does that make some sense? Have I explained that?
Yeah, I mean, that sounds so like strenuous and so painful for someone
Exhausting.
to endure.
Yeah,
Yeah, it's exhausting.
it
I really
is.
empathize with, yeah, anyone who's suffering from this. But yeah, it sounds really really intense, and this sort of makes me put things into perspective where, I think at some point in our lives we might have had a friend who is probably like he likes to arrange things or likes to keep things organized, and we might have identified them as, oh, this person is so OCD because they like to
Yeah.
so when you really hear what it actually is, that really puts things into perspective. And I still see this happening a lot on social media as well, where people sort of misbrand and misrepresent OCD and a lot of other mental illnesses as well, because it's so the next question that arises from this is, how do you actually know where where to draw the line here? Because like you said, a lot of these factors of, oh, if I did I forget to check the gas, or did I forget my keys, a lot of those things are things that we might think about in our daily lives, but the way that we are, how what is the sign that we should look for that this is something that we should probably try and get diagnosed, or what would be the routine grievances of someone who could potentially have OCD?
Right. That's a wonderful question. So essentially, it is important for us to understand the difference between obsessions and thoughts. Right. Now, while someone who is not currently diagnosed with OCD might possibly have this thought that, oh, I forgot to switch off the microwave or whatever before leaving the house. Right. It is easy for them to go about the rest of their day forgetting this thought. Maybe the thought will last a minute, maybe it'll last 30 seconds. Now, someone who is experiencing OCD, um, for them, it is not as easy to really shake away this thought, right? In fact, it seeps into every activity that they do, right? It often distracts them. And it often, like we said, it leads to certain compulsive behaviors, right? So, and this is not solid diagnostic criteria, but most commonly people with OCD will fall into one of four categories, right? So if you notice yourself having obsessive thoughts in or compulsive behaviors in one of these four categories, and if you notice that it is sort of taking over your life, then this may be a good time to get checked, right? So the four categories are washers, right? So some people are, again, as the stereotype goes, afraid of contamination, where they will often have thoughts related to, oh, I'm infected. They will often have mental images, which can be quite disturbing, of germs, sometimes fecal matter, things like that, right? So there is this strong fear of contamination. And this drives them to engaging in compulsive behaviors like excessive cleaning or hand washing. As you can imagine, in my opinion, at least based on some of the cases that I've seen recently, this form of OCD has increased a little bit with respect to the pandemic. Because I know hand washing and just keeping ourselves safe was encouraged, right? But the idea of being infected by the virus was also quite scary. And so it is not uncommon to move into a state of obsession and compulsion when it comes to, making sure we keep ourselves clean, making sure we disinfect everything that comes into our house, things like that, right? So this is something that I've seen increase a little bit over the past year. Another form of, well, these aren't exactly forms of OCD, but another very common experience in OCD would be checking, right? So we spoke about checking the gas. It could be repeatedly checking anything, right? Have I turned off the fan? Have I turned off the oven? Have I locked the door, right? And we often have obsessions which are related to harm or danger in this form of OCD, right? So if I haven't, then this is so dangerous. My house is going to be on fire when I get back. And that is quite a distressing thought, right? Then the third category is basically doubters and sinners. Now, in this form of OCD, a lot of people feel that if I don't do things in a certain way, in the exact order that it should be done, in a perfect way, then something extremely bad is going to happen, or I'm going to be punished, or my family is going to get hurt. So, for example, when crossing the road, if I don't start with my right foot, then God is going to punish my children, right? That's not an uncommon thought in OCD, because these thoughts about harming or bringing harm to yourself or someone else, if you don't do things a certain way, are fairly common, right? And finally, you have the counters and arrangers. And this is also one that I've seen in media quite a bit, where the obsessions have a lot to do with order, symmetry, you know. So if I don't touch my phone 6 times in the morning when I wake up, then I am bringing harm to someone, or something like that, right? If something on my bed is, let's say my bed sheet is slightly loose on one end, then that's going to be terrible for me. I have to adjust it immediately, right? And I will say that this attention to perfection and detail is not only found in OCD. It is also found in certain, sometimes it's a personality trait, completely independent from OCD. So that is something to keep in mind. But this attention to order and detail is also found quite commonly in OCD. So if you have noticed that you or a friend has started, or thoughts related to the ones we just spoke about have started taking up more headspace, are causing significant distress in your life, if you've noticed yourself repeating certain behaviors, if you've noticed yourself avoiding certain triggers that might end up leading to these thoughts, things like, for example, I might avoid uh, touching a railing if I have the fear of contamination, right? So if I notice myself avoiding a lot of these things, that is when it could be a good time to look into OCD and see if that is what's really happening, right? Yeah, I think that is more or less it. I think it's important to just understand what compulsions are, what obsessions are, and if we are able to get that in check, it is helpful to sort of be able to tell if it's a good time to go in and get checked for OCD.
Yeah, that's beautifully summarized, I think. And thank you so much for like highlighting the different categories within OCD. And it's so beautiful to actually see that there isn't just one form. There are so many different varieties in which this disorder can manifest itself. So one thing that I'd like to point out is everyone else on the call, you can please feel free to chime in and ask any questions, or if you have any opinions or anything that you'd like to get clarified, please go ahead and you can type it in the chat box, or you can unmute yourself and ask. So this is really going to be more of an open discussion. So please feel free to do that. And regarding when you mention arranging an order and those things, you're right. I think that is what the media has sort of picked up to highlight. And I see figures like Monica Geller from Friends or Claire Dunphy from Modern Family, who are depicted to have they never I don't know if they outrightly say that they have OCD or not, but she does do things like where she will touch the car a couple of times, or touch the towel railing to make sure that her children don't get hurt. So yeah, those so that sort of the way that I see it, it sort of overlaps between superstition and a fear of not having control, which I think are two things that we can definitely relate with. And especially as part of as Indians, I think that's definitely something that we have had experience with, because mostly Indian children, we don't have control of our own decisions more often than not, right? In Indian societies, there's always like one head of the family who's been directing everything. Of course things are changing now, but still, as Indian children, like, we have to ask our parents for a lot permission for a lot of things. And we are still a lot more grounded than you would the sort of culture that you would see in Western societies. So is that something that you see as a cultural thing, or is this something that will just manifest as just as naturally as it would for any other uh, uh, sort of mental disorder, would like anxiety or depression? Or do you think that OCD is more likely to spring up in certain cultures because they have that lack of control, so that sort of would instill a fear of that lack of control within them, that, oh, I'm not able to control the fact that there might be a fire in my house, or I'm not able to control the fact that I might crash my car if I don't do these three things. So is that more of a cultural thing, or would you just say it's a universal part of nature?
So you are extremely correct when you say that a lot of it comes from the lack of control. In fact, that is what OCD is, right? It's where we don't have control over the rest of the world. We cannot guarantee that if I leave my house, I am not going to come back contaminated, even if I am super safe. I think that's just how the world works. And so OCD is, you know what, I can control? I can control that I wash my hands right now. I can control that for the next 5 minutes, I will be clean, right? And it is us sort of overcompensating for that lack of control everywhere else and that uncertainty everywhere else, and saying, this is something I have control over. I'm going to exercise it as much as I can. That's an interesting point you bring up about culture, right? Because, as yes, I think growing up in Indian families, a lot of the times children are sort of made to be dependent on their parents, submissive sometimes. That being said, I think the lack of control and the idea of uncertainty is universal, right? And you were asking if it differs from anxiety and depression and other mental concerns in that aspect. And I will say no, because a lot of the times anxiety and depression also arise as a response to the lack of control and as a response to uncertainty. In fact, uh, some people now look at OCD as a separate mental disorder, but a lot of other people classify it with anxiety disorders. And I too see it as a manifestation of high stress and high anxiety. Right? So it is definitely a response to the lack of control or to needs that were not met when we were children, maybe the need for safety, right? If my need for safety was not really met in a healthy manner when I was younger, if it's not being met right now, then I overcompensate by, again, checking the locks on my door a number of times, checking the gas. Everywhere else that I know I have control over safety or I can exercise that control over safety, that's where I maybe exercise that control. And a lot of the times, that's where OCD sort of forms.
Yeah, thank you for that. That definitely, I think, opens up a lot of avenues. Where it's interesting that you mentioned that OCD can sometimes also be classified as a manifestation of anxiety, and that really puts into picture just how intense and exhausting it can be for someone who might be suffering from this disorder. So how would you think that as as friends and family of someone who has been diagnosed with OCD, how do you think that they will be able to support them or help them just deal with this disorder better?
Right. Well, I think the first, and this applies to supporting anyone with any mental disorder or any mental health concern, is inform yourself, right? It is very easy to get frustrated. It is very easy to get annoyed when you see someone displaying the symptoms of OCD. Uh, we don't realize how taxing it is on that person. And very often, even if we do, it is natural that we get a little bit annoyed as well. But what it is important for us to do is to fully understand it if we do want to reach out to that person. So, watch videos, maybe avoid Instagram or just use trusted pages, right? Listen to podcasts like yours, which, I mean, that's why it's so great that you are doing this series to sort of debunk these myths, right? I think that's really important. Um, Read up. There are so many resources online. Just find trusted resources and yourself on the matter, right? After that, I think that it is also very important to, as friends, we sometimes say, oh no, it's my responsibility to, you know get this person through their tough time. And I think in literature and in movies, the idea of being the person to hold their hand and walk them through fire is so glamorized, and it's just romanticized, right? But when it comes to mental illnesses, again, not just OCD, but any, it is important for us to encourage that friend to seek professional help, right? Go to a therapist, go to a counselor, go to a psychiatrist, right? It is important for us to reassure them that this is a condition that is not as uncommon as they probably feel it is, and that it is something that there are now, standardized treatments for, there are medications for, right? So encouraging them that it is normal and that it's probably a good idea to seek help is a wonderful place to start, right? Now, when it comes to OCD, as we spoke about a little while ago, we said it is often a manifestation of anxiety or of other stressful experiences, right? I notice in a lot of my clients, when there are these big exams coming up, that is when they will experience symptoms of OCD. I don't know if I would diagnose it as OCD, but definitely some symptoms, right? Or whenever, if someone's going through a really tough breakup, that's when these symptoms might come up. So it does fluctuate with stress. And so if you know the cause for their stress, and if they're willing to talk to you about it, maybe engage in those conversations with them. That can be extremely helpful as well. And very, very importantly, with OCD, it is easy for us to reinforce certain obsessive compulsive behaviors for them, right? For example, helping a person with their ritual, if they have a certain compulsive ritual, or responding to requests for reassurance, or even, if there are certain triggers or tasks that they want to avoid, we do it for them. Now, while I'm sure we do it with the best intentions and possibly to save time and energy, these can actually maintain their OCD and may turn into obstacles to that person's recovery. And so it is important to gradually reduce our involvement in this, right? And I say gradually because that's very important. If we suddenly stop, that is going to be extremely stressful for the individual who is going through OCD, right? So with the therapist's help, maybe come up with a plan as to how you can gradually step back so treatment can take place, right? So these are a couple of things to keep in mind. And I think, again, as with any disorder, ask. Don't be afraid to ask the person, what do you need from me right now? How can I be of help to you? I can't claim to understand this necessarily, but I do want to be here for you. So, tell me what you need. And I think providing that support through this difficult time is more meaningful than we realize.
That's beautiful. Yeah, I think that's a wonderful way to support someone and show solidarity with what they're going through. So I definitely think that's going to be a very effective way for friends and family to support someone who's going through this. But I'm also interested to learn more about what workplaces can do. So, from the way that you've described OCD, I feel like in a workplace, it's going to be just a chaos that's manifested in your mind, right? If you're, let's say, you're in a conference and suddenly some triggers kick in, and so you start having these like terrifying thoughts while you're in the middle of a presentation, that just feels like an impossible situation, and something that's going to be very difficult to take control over. And if say I'm in my workplace and I see that someone who is delivering their presentation is suddenly, facing these triggers, or just visibly very distressed because of something that might be happening, what would be a good way to support them in that situation? Because now, yeah, that it's true that a lot of workplaces are implementing, they're making sure that they have counselors, and that they have the adequate human resources to handle these situations. But more often than not, we don't really see it manifest adequately in reality. So if I were to see something like this happen in real time, where I see someone actually being distressed, how can I help them or better assist them in a workplace environment?
Right. That's a wonderful question, actually, and I think something that all of us go through at work is this need to put on a mask. Even if I am going through ABC, all these problems underneath, to be professional, I have to put on this mask, and that makes sense. I understand why we do that, but like you said, if you are giving a presentation and you maybe start to experience intrusive thoughts or obsessions, and you feel the urge to act in compulsive behaviors, uh, while me, as someone who possibly works with you, while I can't tell you what to do, I can't tell you not to engage in these behaviors, and I can't necessarily make you feel better in that moment. What I can do, in addition to everything we've already spoken about, is normalize it as much as I can for you. So the thing is, at workplaces, while the OCD is stressful enough as it is, we also have this added layer of worry that, oh, great, now what's going to happen? What is everyone going to think of me now? What do I have to explain to people? Right? Oh, they're going to be so angry with me. And as colleagues, and again, I think this applies to any disorder, to create a sense of tolerance and support, this network of understanding, it is important for us all to go through training programs when it comes not just to work life balance and depression and anxiety and the more common ones, but also just how to respond to anyone in significant distress, right? It is important for me to know that I might have to put my emotions aside just for a bit to try and understand what that person is going through. And through this process of normalizing it for them, again, maybe even talking to them about it if they're comfortable with it and offering help, right? I am doing so much more than you would think. I am telling them that, I understand. And that while this is extremely distressing, I do think that it is also treatable with, mental health care. By creating that warmth and that sense of empathy, I am again doing so much more than I think I am for that person. Right. So putting aside my own biases of what professionalism has to look like, or what I think mental illness looks like, or how I can't understand that someone is nervous in a presentation because I don't have the fear of public speaking, trying to put those things aside and really just trying to understand this person and put myself in their shoes, right? That does make a big difference. I'm sorry if that was not the answer you were looking for. That was very similar to the previous answer.
No, that's perfect. I think I think that's the core of understanding mental health is right. It's just having empathy, because of course not everyone is going to suffer from the same challenges, but just being able to understand that okay, someone else might be having a different experience than you do, and they have a different circumstance, and just empathizing with that, I think is
Yeah,
so wonderful and so important. And a lot of times you forget to do it, but I love the way that
absolutely.
you placed it. Yeah, I think so. Thank you for that. That's
I just want to
definitely
add
a
to that. I
helpful thing.
think
Yeah.
as we said, there is this other layer of worry, right? What will people think of me? Especially if this manifests at a workplace. And a big fear for a lot of people is that people will think I am now less worthy, or I'm not good at my job anymore, or I am weak, right? And so continuing to treat that person with respect, continuing to treat them as responsible, accountable adults while also treating them with empathy can be tough, but it is a balance that is very important to strike, I think.
Yeah, I think that's very beautifully put. Does anyone else on the call have any questions, any
Yes.
follow-ups to that?
Yeah. I actually have a follow-up question. Hello, I'm Rishikesh from IIT Bombay. Uh,
Hi.
hi. So, ma'am, I have observed that a few friends and colleagues of mine here at IITB, they experience panic attacks every time and then whenever an important event is coming up, be it
Mhm,
the semester end exams or finals of some international competition.
mhm.
So, a person who is totally capable of nailing it suddenly starts to question if he's really the best in the trade. And I have observed this with quite a number of students here. So can we group this mental tendency of theirs to be sort of the best in their field, always, like whatever fields they are in, they want to be the best? Can we group this into OCD? Or
That's a great question, Rishikesh. And no, panic attacks are quite different from OCD. That being said, it is not impossible for someone to experience OCD and panic attacks at the same time. But based on what you've said, it does sound quite different, right? It sounds like possibly another anxiety disorder, possibly not even a diagnosable disorder, right? But just significant levels of anxiety. And I think you're quite right. A lot of the times, anxiety comes from, or even panic attacks come from these extremely high standards that we place on ourselves, right? These extremely rigid demands that I have to be the best at what I do, or my presentation has to be flawless, or this event has to go off perfectly,
right,
right?
right,
And again, similar to that sense of control that we were talking about previously, we don't always have control over how the outcome is going to be, right? And that lack of control can manifest as panic attacks or anxiety and some of the things that you mentioned. Does that make a little bit of sense to you?
yes. What's the solution to this? Can meditation or yoga, doing such kind of activities, will help in calming ourselves down? Uh,
To a certain extent, there is no sort of one standard answer, because what works for me might not work for you,
right,
right?
right,
To a
right.
certain extent, meditation, grounding techniques, breathing techniques work. But if in fact this is really coming from these demands that we've placed on ourselves, these rules that we create for ourselves, then it is likely that we created these rules a long time ago. And we are very habituated to these thinking patterns. And to maybe look at these rules and possibly change them and turn them into healthier, more realistic demands, that is something that would take a little bit more work. And that is something that we see in therapy all the time. So if your friends, or if you feel like you have the resources to go in for a therapy session, then that is something I highly recommend.
Wonderful, ma'am. Wonderful. Yeah. Thanks a lot.
Thank you.
Thanks for your question, Rishikesh. So, and thank you, Minaish, for that wonderful answer. I think it's going to be relevant for a lot of students out there who are currently dealing with the whole online examination and online class situation. So yeah, thank you for that. But thank you, Rishikesh, for that segue. I would really love to, after highlighting the elements of OCD and how friends and family and colleagues can help with it, um, I would like to get into a little bit of, not into too many details, but just about the sort of therapies that would be effective for OCD treatment. So, like Rishikesh highlighted, yoga and meditation and things like that. But there are a lot of foundational therapies in place that we have heard quite a bit going around on social media, and that would include cognitive behavioral therapy and insight therapy and exposure therapy and things like that. But again, like, just to sort of decrypt these buzzwords and really understand what exactly does OCD treatment entail.
Yeah, that's a great question, Ananya. So, ideally, and again, this is different for everyone, but a lot of the times it is a combination of psychotherapy and medication that work best, right? When it comes to OCD. And that's because with OCD, we've noticed that the levels of serotonin, which is this neurotransmitter in your brain, is a lot lower than in people who may not be suffering from OCD, right? So certain medications to deal with that are often administered. That I will not talk about too much because I am a psychologist, not a psychiatrist. And I think you had spoken about the differences between those two in one of your previous podcasts, right? So I won't touch on that too
Hmm.
much. But I will talk about the therapeutic aspect of it. So we'll start with CBT because I think that is one of the most commonly used therapies when it comes to OCD. CBT stands for Cognitive Behavioral Therapy, right? And I'll tell you what this means. So, CBT works on the premise that our cognitions, that's our thoughts, our feelings, and our behaviors are all interconnected, right? So, thoughts, feelings, behaviors. Now, by that logic, our feelings, which is, whatever it is, anxiety, depression, this fear that a lot of us face, right? The fear that is involved in some of the obsessive thoughts when it comes to OCD, these are maintained by certain thinking patterns or certain cognitive patterns and certain behavioral patterns. So, what CBT does is it says, okay, if we are trying to change these feelings, if we are trying to um, change some of these unhelpful emotional states, what we are doing is we are going to be working on the thoughts and on the behaviors separately. And this hopefully will lead to a change in our emotional state. So, when it comes to working with behaviors, this is where ERP, which is exposure and response prevention, is extremely popular, right? Whether it is, especially for OCD, actually. And just like OCD has two parts, which is your obsessions and your compulsions, exposure and response prevention has two parts as well. As the name suggests, that is exposure and response prevention. So, what happens here, if you remember that OCD cycle we were talking about initially, where there's this obsessive thought and that brings about some anxiety, and to reduce that anxiety, we engage in a certain compulsive behavior, and then the obsessive thoughts continue and the cycle gets stronger every time. ERP tries to break this cycle. And how it does that is, as part of exposure, it, well, as the name suggests, again, it exposes the client or the patient to these triggers that make them anxious, right? Now, for example, if I am someone with the fear of contamination, again, right, I will construct this ranking or this ladder of all the different triggers. For example, touching a railing or touching a doorknob while using a public bathroom. And I might say that, okay, using a public bathroom brings me 80% anxiety, touching a doorknob brings me 20% anxiety, right? Now we start with the easiest. We start with the doorknob in this case. And over here, what we do is we expose them to the doorknob. We ask them to touch the doorknob, right? And after that, we ask them to stay with this discomfort that they're feeling, to refrain from their compulsive behavior. And I know while I'm saying this, it sounds like torture, and I'm sure it feels like that too. It is extremely anxiety provoking. But what happens then is after a while, that anxiety gradually reduces. The more they stay with it, they give themselves, or they give their brain the message that engaging in this compulsive behavior is not my only solution for reducing my anxiety, right? It is very similar to the whole face your fears, right? Which is something that social media in all fonts and colors and sizes blows up and it's on everyone's story. And there is some science to it as well, right? Rather than avoiding our triggers, if we face them, we sort of give our brain the message that, oh, you know what, this is terrible, but it's not as unbearable as I thought it would be. And this continues. We repeat this a couple of times. We continue to expose them to the trigger until the anxiety reduces, up until a point where it's not even terrible, where it is something that they can absolutely stand, right? So after that, we move on to a different trigger, one that possibly produced a little more anxiety, right? For example, maybe touching a railing, right? And by constantly exposing them to these triggers, but also asking them to refrain from their usual compulsive behavior, we are essentially breaking that cycle that we spoke about previously. And it is uncomfortable. I will say that it is not a pleasant process for the person, but it has been found to be extremely effective. And the people that may have stopped themselves from stepping out of their houses previously can learn to go about the rest of their routine after treatments like ERP. So it is really wonderful, right? Now, on the other, so that's the behavior, right? But on the other hand, we said that something that is also helpful is working on the thoughts. Now, uh, there is a lot of interpretation when it comes to OCD. And what I mean, well, when it comes to any disorder or any of our experiences as well, we don't necessarily see the world as objective reality. We interpret it in certain ways. And these ways are subject to all kinds of biases, right? Um, so, not all thoughts are necessarily real. Not all thoughts are necessarily facts. And this is something that CBT addresses, right? CBT says, okay, let's say you want to go to a car dealership, you want to go buy a car, and you meet this sales representative, and they say, oh, you know, this is a great car, this color is selling really fast and it drives really smoothly, it runs the engine. Okay, I don't know too much about how cars work, but they say it's a great car, thumbs up for this car, right? Now, do you say, okay, I'll take it, or do you say, okay, I will take it on a test drive? What would you say, Ananya?
Yeah, you'd want to take it on a test drive
Yeah,
before. Yeah.
because you wouldn't directly believe that person, right?
Hmm.
Now, that's sort of what we aim to do with our thoughts as well. Why are we directly believing all of our thoughts as they come our way, right? And so CBT says we're not necessarily trying to think positive or anything like that. We are just trying to think objectively. So we challenge our thoughts. We look at whether there's any evidence that proves that our thought is not a fact. We look at how likely is our thought really, right? We learn to challenge our thoughts. Um, Another thing that we do with some of our thoughts, and this isn't necessarily CBT, it involves a lot of mindfulness based therapy, but is we learn to accept these thoughts. So with intrusive thoughts, researchers have found that it is not that these thoughts only come to people with OCD. It is not that the rest of the population does not experience these thoughts, right? It is just that people with OCD internalize these thoughts. They say, oh, you know, I'm having this thought that, you know, a lot of the times obsessions can be in the form of violent images, right? So they say, okay, I have this image that I'm gonna hurt my partner. You know, I can see it. What does that mean about me? Does that mean I want to hurt this partner? I'm a bad person for having this thought. I'm responsible for this, you know, what? And we just get very scared of this thought, right? So, what mindfulness based therapy does is it helps us detach a little bit from these thoughts. Is it helps us say, okay, this is not my thought. If it was my thought, then I would have been able to stop it. And clearly, I've tried that and that's not working. And the fact that I can't stop it possibly also means that I didn't create it. And so I don't necessarily have to internalize it. And it's tough, again, not to automatically internalize and believe our thoughts, but learning not to judge them is a huge, huge part of treating OCD. Learning not to, say, okay, this is a bad thought, this is a good thought, what does this thought mean about me, right? Being able to maintain that slightly detached or decentered perspective when it comes to our thoughts and our experiences can help a lot, right?
Mhm.
Um, so that is something that I like to introduce when I am treating someone with OCD. But you asked about insight therapy and talk therapy, and I think, like we spoke about earlier, very often obsessive compulsive symptoms are an offshoot of a particularly stressful experience in someone's life, right? Or stress levels. And I think while it's wonderful to work on the OC symptoms, it is also important to address those other stressful symptoms, right? Or to even address what's going on in their life other than this, to even talk about how it's affecting their life in different ways, right? To help them form insights into how certain events in their past may have led to certain processing in the present. And that's what talk therapy and insight therapy sort of does. So,
Mhm.
those are some of the most common interventions used in OCD, as far as I know.
Yeah, thank you so much for that. That was really, really incredible to learn about. And I think it's really cool that it's almost like a mindful practice. I think very often we all, when we experience like thoughts within ourselves, whether that's just like a song that's playing at the back of your head, or whether it's just a thought of, of checking the gas, a lot of times I feel like it's our thoughts that are leading us rather than us actually directly controlling them. So you're right. I love that you talked about, not having to internalize our thoughts, because it's probable that we didn't create them ourselves, and it's just something that's manifesting itself. But yeah, I think the whole tip about mindfulness is very important and important, no matter what we're dealing with, especially at this time, because it's so easy to just get into your own whirlpool and just uh, think that the world is just collapsing into itself. And
Yeah.
but yeah, but it's good to just take a step back and realize, okay, things aren't that bad, and I still have control, and I can still get my way through this. So that's a wonderful tip that you shared, so thank you for that.
Thank
And
you.
yeah, and I'm sure that you get this all the time and you have to deal with it 7 days throughout the week. But the just for our general edification, uh, if there is a scenario where, let's say, a mother she's biting her nails, right, and and the daughter sees that, is it possible for her to pick up on that sort of behavior? Is OCD something that can be triggered in different people, like if they didn't show those patterns before, but then after looking at someone who's reflecting those symptoms, can they actually pick that up? Is that something that's possible?
They absolutely can. And I think that's because it's not just looking at it. Right now, assuming I have a mother who is uh, someone who it does experience OCD, right? It is very likely that the way we live our lives is going to be a way where there is absolutely, just high precautions taken all the time. Maybe I see my mother check the gas 7 times and I realize that it is so, 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 so important for me to be absolutely safe, right? And just the ideas and the beliefs that get passed down to me could also then make me a little more susceptible to developing these OCD symptoms later. There is also some amount of a genetic component to it, right? But that is not enough, or that is not all that leads to the presentation of OCD symptoms, right? So it is a combination of a genetic component as well as your environmental factors. And if I am a child and my mother is someone, or my parents are people who suffer from OCD, then it is likely that both the genetic and environmental factors will possibly prime me to being a little more susceptible to this condition. I would say it's not absolutely necessary. There are a lot of people who have parents or who have lived with people who do experience or who have experienced OCD symptoms in the past, and these people don't necessarily develop it in the future. But I think that's a wonderful question, and it definitely does play a role in determining how likely it is that I will develop OCD symptoms at some point.
Yeah, thank you for that. So, I mean, all of this is just is such valuable information. So, thank you so much for sharing that. And now we get into our rapid fire myth busting session.
Ooh, okay.
So essentially, what's going to happen here is we have six myths that hopefully have been debunked throughout this session, but just in case, just to like really cement it, we'll just pick up like a few myths that have been going around on social media or something that you might have watched on television, and we'll just talk about why that's not the whole picture, why that may not be entirely accurate. So that's the first myth would be that OCD is just about hand washing and cleaning and being neat. So
Hmm.
so how would we is that how much truth is there to that?
I would say that I know people hate this, especially within the community of therapists and psychologists. People are very angry at this representation, and I see why. But I will say that there is some truth to it. I mean, there are definitely elements of, like we spoke about, right? That fear of contamination or compulsive cleaning behaviors. But that is definitely just one aspect of OCD, right? It is about so much more as we looked at it, right? There was cleaning, there was checking, there was just this fear that I will commit a sin, or that this constant doubting, right? Obsessions to do with that. There are obsessions and compulsions related to order. There are so many other manifestations of OCD that media doesn't really portray. So it is absolutely not about just cleaning. And I will say that if you notice someone, sweeping and swabbing their room excessively, try your best not to call them an OCD patient, because that could be causing more harm than good.
Yeah, I think that's very well put. And one half of it is just calling someone else an OCD patient, but a lot of times it could be self-doubt. So, for instance, if there's someone who needs to have all their books in alphabetical order and just have their clothes color coded, and they get bothered if someone dirties the house or just this is disorganized in general. So, is that a valid reason for them to think that they might have OCD?
Uh, so I understand why they may think that, if they get bothered if things aren't neat, or if they get bothered if things aren't in a certain order. But unless an obsession and a compulsion, right, which we sort of spoke about earlier, and the involuntary distressing thought, that's the obsession, and this compulsion to uh, rearrange it or to behave in a certain way, possibly repeatedly, is present, then it's not OCD. It could just be attention to detail. It could be a personality trait in very, very, very extreme forms. It could also be OCPD, which is obsessive compulsive personality disorder, which is a little different from OCD. It does involve a lot of attention to detail. It does involve very rigid forms of thinking. It does involve sort of black and white perfectionistic thinking, low emotional expression, and things like that. But because that is a personality disorder, that is a fairly stable personality trait, right? A great way to differentiate between these is, as we said, OCD can fluctuate with your stress levels, right? It's not something that you're necessarily born with. Whereas with personality disorders, these behaviors tend to be fairly stable over time, right?
Mhm.
Another way to differentiate it is that someone with OCD often recognizes that this is a condition and it's causing so much distress, uh,
Mhm.
whereas someone with OCPD is sort of fairly happy in their ways of thinking and don't really want to change that,
Mm.
right? Because this is, I mean, attention to detail and the idea of perfectionism is a high priority for them,
Mm.
right?
Yeah.
I know this is supposed to be like this rapid fire, and I'm just taking
No,
many,
no,
many,
I'm
many
glad
minutes
that
to
you
answer
are.
it.
And it's
But
no,
yeah,
I think that's important. It's wonderful that we're able to see so many sides to a disease that isn't actually spoken about as much. But yeah, I find that very interesting that it's possible to just be satisfied and feel fulfilled with that feeling of of striving towards perfectionism, because you're right, or very often it's portrayed as like a negative thing, that if you're constantly striving for perfection, then there must be something wrong with you. But it's really interesting to note that there are people who can find fulfillment in that goal. So that's a wonderful thing to keep in mind. Which brings me to
No,
our
Ananya,
myth number. Yeah,
I
Rishikesh, go
have a
ahead.
follow-up question here. Can I ask now, or
Go
you?
ahead. Yeah, yeah,
Yeah, yeah.
absolutely.
So I really got confused whether overthinking, over-imagining, or sort of living in a fantasy world also is a part of OCD. Is it, or is that something different?
So I will say that with OCD, our imaginations do tend to take over sometimes. It's similar to what we spoke about when we were talking about CBT, right? How
Right.
a lot of the times the way we interpret certain events or interpret certain thoughts are given a lot more importance than objective reality. That being said, overthinking and even sometimes having this slightly delusional perspective is not necessarily OCD. I can think of a lot of other disorders that these may be present in. For example, just your generalized anxiety disorder, delusional disorder. But I also do want to say that these are not necessarily disorders, right? We all overthink sometimes.
Right, right,
We
right.
all sometimes believe things that are not very realistic, logical, right? And so for us to be having this conversation without mentioning the fact that to some level these behaviors are very normal, I don't think would be very fair, because the idea of, I think, this discussion is also to learn that we don't have to jump to a clinical diagnosis for any behavior, right? It may be OCD, it may not be, it may be another disorder, but it also may not be. Uh, Anxiety and overthinking is generally a sign that you are stressed. And if this is the case, then again, I do recommend that you seek professional help. You don't have to wait until symptoms get to this clinical level or this diagnosable level until seeking professional help. If excessive worry, excessive imaginative thinking, excessive overthinking is causing you some amount of distress, then I think it is important for us to focus not on what disorder this could possibly be an indication of, but more on, okay, where is this coming from at this point in my life, and how is it affecting me, and what can I do to manage it or to change it, right? Does that make sense,
Yeah,
Rishikesh?
yeah, yeah. So just to get it straight, OCD is connected with stress, right? If there is no stress, then it's probably not OCD. Is that right?
Mm,
Or
it's not as clear cut as that always. Also, it's very tough for us to measure whether there is no stress or
yeah, yeah.
some stress, or the stress isn't always this very obvious manifestation, right? But you
Yes,
are
yes.
right, OCD fluctuates with stress levels, that it is very affected by stress levels. Yeah.
Wonderful, wonderful. Thanks a lot.
Thank you.
Thank, yeah, thanks, Rishikesh. Thanks, Minaj. So I'm so sorry for this session having to stretch on, but we will. I promise, Minaj, we won't take more than 10 to 15 minutes of your time. And
Those
yeah,
are
moving
all.
on. I mean, as much as we need, like all the time that you have, we'll just try and like fit this in. But yeah, myth number 3: everyone has a little OCD. Is that
Mm,
yeah? Is that very accurate?
it is not very accurate. So to say everyone has a little OCD would almost be like saying everyone has a little depression, right? Or a little bipolar disorder. Uh, that's not necessarily the case. So with these conditions, there are certain criteria that we fit, right? If we are to be diagnosed with OCD, it is common for people to have some symptoms of OCD, right? Sometimes. But there are certain criteria. Now, depending on which diagnostic manual you follow, I know in India we follow the ICD, and that says that, I think it says that for 2 weeks at least, the person should have had distressing obsessions or compulsions for at least most of the days of the week. I know the DSM says that these obsessions and compulsions should take up a minimum of 1 hour in a day, right? So there are these very fixed criteria. And for those that don't meet the criteria, it's not that they have a little bit of OCD. right? It is common to have some of these symptoms, and if it's not causing the person too much distress, then I don't think we should be categorizing it as OCD at all.
Yeah, thank you for that. I think it's easy to get swept up in,
Yeah,
like you said, those thoughts that, oh, if I'm, very compulsive about. I mean, I think a lot of us can be impulsive about a lot of things, but it's important to not diagnose ourselves. And
uh-huh.
yeah, if you think something is wrong, then of course you can seek professional help, and you should do that. But yeah, just it's a good note to just not immediately diagnose ourselves with that. So
Absolutely.
thank you.
It's I think OCD is one of those disorders where some people think it's really, really rare, and some people think it's really, really common, and no one knows what it's actually like. So I think there was this international study that said around 1% of the adult population has diagnosable levels of OCD. I think in
Oh wow.
India, they say there was this study in college students which said about 0.8% of the population have it, but I think there was this other study which said 2 or 3%. So with these
Mm-hmm.
studies, it does vary quite a
Mm-hmm.
bit.
Mm-hmm.
And that's where your question about cultural differences come in, and that's quite interesting. Then if you want to go ahead and read some of those papers, right, I'm sure they'd talk about that a little more.
Yeah, I'd love
But
to.
yeah, I think at the moment it's possibly maybe a maximum of 5% in the I'm that's me going out on a stretch here. I
Mhm.
really hope I don't get backlash for this if that's totally inaccurate. But yeah, based on the studies that I've seen, I haven't seen a statistic that says it's more than maybe 4% of the population.
That's quite interesting to note, and I hope that there's a lot more research being done on this because it's important for us to just be mindful of. I think a lot of people aren't entirely aware of what OCD means, so it's important that yeah, these research studies are undertaken. And yeah, I think from the statistics that you mentioned, it seems to be pretty relatively rare. But then again, India is massive, so yeah. But this brings me to the next myth that we have, which is that you can easily tell if someone has OCD. So if you just see a coworker constantly arranging their things, then immediately you're like, ah, that guy's got it. But
Yeah.
it's not so simple and straightforward as we've seen.
It's really not. And I think we all do this. I know in this conversation I'm making myself seem like, oh, I never assume anything about people, which is totally untrue. I'm just gonna out myself here. I think we've all done this sometimes where we just look at someone and their behaviors and we try to fit them into a little box. But as we've learned today, that this our idea of this box, firstly, is a lot smaller than the actual size of the box, right? And we really don't know. A lot of OCD is something that I should have mentioned before. Is it is very common. Well, it's not. I mean, it is common for someone to have predominantly obsessive thoughts and not too many compulsive behaviors. It's also common for someone to display more compulsions and not too many obsessive thoughts. And then there is the mixed type that we've been speaking about so far. So it is very possible for someone to just have these obsessive thoughts and we might never know, right? That is still OCD, but we really don't know what's going on in someone's mind and in someone's you know thoughts. And as we also saw, OCD presents itself very differently, and it is not always going to be easy for us to pinpoint what is OCD and not. The only person that can really make that statement would be a licensed professional.
Yeah, I think that's beautiful, beautifully put. And I think that's the deal with mental disorders, is that you can never see them. If you have a wounded knee, you can see that yeah, it's been bruised, and like everyone is able to see that you've been wounded. But it's so much trickier when it's a mental disorder, because it's so hard for you to even know if something is wrong. Which brings me to the final myth, that OCD is a pretty mild disorder. And at the end of the session, I don't think, like, there's no doubt in my mind that it really isn't,
Mm.
because it just sounds so grueling and so exhausting for a person to go through.
Absolutely, it really, really is. To just have that state of constant, rumination, obsessive thinking, this constant urge to engage in repeated behaviors. I know that there are some clients who will literally stand in front of a sink and wash their hands for hours, right? And to have to spend so much time engaging in these obsessions and compulsions, and to spend so much time avoiding potential triggers. Like I said, there are people that may choose not to leave their house at all, right? And living in this constant state can be extremely exhausting, extremely anxiety inducing. And it isn't just a cute term to assign to Monica Geller or Claire Dunphy, like you said, right? It is a very serious disorder, which should ideally be treated as much as it can.
Yeah, it absolutely. Thank you so much, Minaish. I think that's a beautiful takeaway from this entire session, that we need to keep ourselves informed, and take this seriously, because and now like what better time than now, right? With everyone dealing with their own set of challenges, I think the best thing we can do for each other is just to be empathetic. And yeah, so that's a beautiful message to take home. Does anyone have any final closing questions before we end this call?
No, not me, but that was a really nice session. I really loved it. Thanks a lot.
Thank
Thank
you
you
so
so
much,
So
much.
Rishikesh.
I'm Karthik. So I had a question. So
Go
Hi,
why,
ahead.
Karthik.
what might be treatments for like obsessive cleaning, and that what might help to cure it?
uh, when it's part of OCD, is that what you're asking? If that's a part of OCD?
No, like in general, if there is only one symptom of OCD, like just obsessive cleaning of hands.
So if that is an obsession, and if that is, again, even if it is just that one symptom, but if it is distressing enough and it is frequent enough for it to be classified as OCD, then I think the treatment forms that we spoke about earlier, which is ERP, CBT, a little bit of mindfulness, I think these could be really helpful there as well. But I think what should probably happen first is that if there is just one symptom that we are noticing, a thorough assessment needs to be done, right? To check whether are there any other symptoms that we aren't really noticing. Are there mental rituals, right? While repeatedly cleaning our hands is something very noticeable and observable, a lot of us have repeated mental sort of thought patterns that we don't even realize we follow, right? For example, repeating a phrase to ourselves 6 times in order to make sure that something doesn't go wrong, or whatever that is, right? So again, a professional will make sure they conduct a proper assessment, and accordingly, if they see these as symptoms, as OCD, symptoms of OCD, then I think the treatment methods that we spoke about earlier would apply here as well, if that answers your question.
Yes, ma'am. Thank you.
Thank you.
Yeah, thanks, Karthik. Thanks, Rishikesh. And thank you so much, Minaish. I think all of us have learned so much in this session, and it's going to reach so many people, and they are going to get so much more aware and learn so much about OCD and all the other things that you mentioned as this bonus package of just your mind exploding with all of this wholesome knowledge. So thank you so much for that. It's
You're really
always
boosting my self-esteem today, Ananya. Thank you.
Absolutely, yeah. It was really enjoyable for me to learn about these things, and yeah, I really hope that this does some good, and it reaches the people who it can really help. So thank you for that. A lot of wonderful knowledge floating around in this session today. So really grateful for that. And yeah, thank you everyone for joining this session. And yeah, I definitely add some links that you mentioned, Minaj, to those research studies at the end of this podcast, so you can definitely go ahead and check those out if you're still when you want to feed your yeah, instincts on those. So yeah,
Thank
that's
you. Thank you so much, Ananya. Thank you so much, everyone, for having me here.
yeah, absolutely. Thank you so much, Manaj. All right,
Bye.
everyone. Bye, everyone. Have a great
Have a
day.
nice Sunday. Bye.
Yeah, bye
Yeah, thanks a
bye.
lot.
Yeah. Thanks, everyone.